Good afternoon. Welcome to this month's American Institute of Dental Public Health ECHO session for our Rural Oral Health ECHO Innovations in Patient Communication and Engagement. We are thrilled to have all of you here today with us and look forward to providing you with a really interesting, enriching, and valuable discussion from a didactic presenter who'll be joining us, followed by a case presentation that we will dig into as we often do, as we always do, in fact, as our ECHO think tank. So I'm going to ask my colleague, Rahel, to please share the slides, and we're going to get started. Thanks for your patience. Rahel, are you able to hit share? Okay, there we go. Thank you. So our topic today is innovations in rural oral health, patient engagement, and communication. Next slide, please. We want to start off by thanking our partners in this program, CareQuest Institute for Oral Health, the Oral Health Progress and Equity Network, UNLV, and the National Rural Health Association. We appreciate your support and partnership. So our agenda for today, we're going to go over some brief housekeeping items and give you an overview of the call. We're going to have a didactic presentation on the topic of patient engagement and communication. We'll then spend some time answering your questions, and then we'll dive into our think tank discussion, building trust through community workshops, where we'll reflect on the learnings from today's presenter and apply it to a case that we're going to share with you. Next slide. Quick housekeeping items. Today's session is being recorded. We ask everyone to keep themselves on mute until they're ready to speak later on. All slides, forms, and materials are going to be available on the AIDPH website after today. We ask everyone to please type their email address and organization name in the chat. And we also invite you to add your personal pronouns to your Zoom name. Please avoid sharing any personal health information on this session. And if you have any questions about using Zoom while we're together today, please send a chat to my colleague Liz Flannery in the chat box. Next slide. For those not familiar with AIDPH, the organization has a vision of an equity-oriented oral health workforce that's prepared to lead. Our mission is to foster professional excellence and advance innovation in the education and practice of dental public health. Our communities of focus, where we focus our education, leadership, and research work, are rural communities, veterans, LGBTQIA+ communities, and individuals living with disabilities. And I invite you to learn more about our organization and the communities we serve by visiting our website, aidph.org. Next slide. Here on this slide, we share an overview of the ECHO model for anyone who's new to ECHO. The idea is we bring folks together in a virtual format to learn from subject matter experts and then to learn from one another in an applied learning exercise. And the intent is for participants to take back the learnings to their communities and apply the frameworks, the lessons, the approaches to challenges they're facing in their own organizations and communities to improve access to oral health care and reduce disparities. Next slide. This particular ECHO recognizes the distinct needs and opportunities for improving access to oral health in rural populations, and it builds on last year's ECHO program, which focused on special topics in rural oral health. We're happy to offer CEUs for each session after you complete a competency assessment and evaluation. And if you complete successfully 6 competency evaluations for 7 of our sessions, you will earn a certificate in innovations in rural oral health. So we encourage you to do that and to visit our website to take a look at the past sessions if you missed any of them. And you can watch those and take the competency quizzes there. Next slide. We have 1 remaining ECHO session in this calendar year, and that's going to be actually later this month, which will be on the topic of rural Indigenous veterans. We encourage you to register for that and join us as well. Next slide. Our session norms are here on the screen, and they really center on respecting everyone else who's on the call, introducing yourself, keeping your video on, but keeping yourself on mute, limiting any distractions, and respecting patient health information. Next slide. And our presenter declares today that she has no financial arrangement or affiliation with a corporate organization offering financial support or grant monies for today's event. Next slide. So with all that out of the way, it is now very much my pleasure to introduce today's speaker, Crystal Spring. I'm going to tell you a little bit about Crystal before I turn the microphone over to her. Crystal is a registered dental hygienist and the founder of Smiles Across Montana, a nonprofit mobile dentistry organization that serves the state with access to care programs that are changing lives and building bridges between public health and organized dentistry. Crystal and her nonprofit team focused on a whole health approach to preventive services and work diligently to advance medical dental integration into the healthcare system. Crystal works with several nursing schools to add the use of innovative technologies such as intraoral cameras, teledentistry, oral cancer screening, and preventive oral health services into their curricula. Through her speaking and mentorship programs, Crystal's spirited approach to leadership and advocacy shines through, as does her passion for public health, the advancement of medical dental integration, and optimal healthcare for all. Before I pass the mic to her, I'm going to ask folks, if you have any questions, please pop them into the chat box. We're going to get to them when Crystal finishes her remarks, and we'll also have some time for discussion then. Crystal, take it away.
All right, thank you. You can advance to the next slide. So the learning objectives today, I know that we have a little less than 20 minutes, but we're going to be able to describe strategies to communicate effectively with communities lacking access to telecommunications and fostering engagement and trust. So that's been a really important part for me, is really building relationships, and I'll be talking a lot about that today. They'll be able to examine creative and cost-effective outreach methods and transcend technological barriers. And then the last objective is value real-world examples of oral health care professionals who have successfully engaged with underserved communities through compassionate communication. And just kind of explaining what compassionate communication and what we mean by that is, just really putting yourself in someone else's shoes. If you haven't grown up in an area with low access to care, if you're not from a rural environment, these things might be new to you. You can switch slides. So the first thing we're going to talk about is communication style. And this one has been kind of funny for me because, even though I live in Montana, I have a cell phone. I am on my email all the time. I actually have 4 or 5 different emails and I check them all. There's probably a lot of you that are the same as me out there. But what we've noticed when we're trying to communicate with people in some of these smaller communities, that yes, in fact, everyone probably does have access to a cell phone or a smartphone, but they might not have an actual number. It might be something they can only use in an area where they have Wi-Fi. So we've had to learn to communicate through WhatsApp or Facebook Messenger. That's been a big one. Sometimes some of the groups we've worked with, like if we're trying to get a hold of someone and they've given us a phone number, it's written in their consent, because our program, we see children without parents present, but it is still really important that we can communicate with those parents. So before we'll ever even see their child, we're going to call them and we're going to make sure that they understand what they signed, what the consent says. And this is a huge time. This takes up a lot of our time, but it's really important that we are able to communicate with the parents. So we are using, WhatsApp or Facebook Messenger, to talk to a lot of people. I just think that might be a little bit surprising to people, because it was to me at first, and you have to look at HIPAA and make sure you're talking to the right person. We're not leaving messages that are sharing information about patients, but we are able to connect and say, is this in fact this person? And then we can find a way to communicate with them. You can go to the next slide. So in this communication also is, it's really important to be culturally aware. A lot of questions are just harder than you think. Who's your, do you live with mom or do you live with dad? And a lot of places throughout our country right now, they might not even live with grandma. They might be living with, a cousin or an auntie. So it is important when you're asking questions, who has guardianship? Where do you live? Do you live there all the time? You're going to have to ask a lot of questions of, either the school or who signed the consent. Those have been some concerns that we've had. Something that I've learned from one of my friends teaching me a lot more about his culture is that in his culture, like if a child says, "Oh, that's my mom, she's in the next room," in that culture, his mom is, so they will call their mom's sister mom. Their dad's sister is auntie, but the mom's sister is mom. So that can be a little confusing too. And so that's why it's really important to be digging in, asking questions, and getting to know the communities you're working in. You can go to the next slide. So a lot of our patients, some of the things that we really had to help with and really humble everyone who works for us is, we're wanting, are you signed up for Medicaid? How can we get you help? Well, they don't, if any of you have ever tried to sign up for Medicaid, and I'm sure you on this call, people have helped people in the past do that, but it's not as easy as, it might be for some of us who have actual access to, all your records. You have your Social Security card like in a file somewhere in your home. I would say there's a large portion of Americans that don't have this information. And so, some of the things that we've had to do is communicate with parents to help them in their community find the right resources that can help them get signed up. Next slide. Okay. And, even when they do get Medicaid, something that has been a barrier for us is, we've helped people get insurance, they're being seen, but we can't find providers to take their insurance. So those have been issues where my team, we've actually went in and we have lists that we've called every office in the state. We can actually look and say, so it says this office is a Medicaid provider. Are you taking new Medicaid? Are you taking adult Medicaid? And those kind of questions that just help to make it easier for our patients and their families when they call an office, so they don't have a feeling of, I hate this word, but like I don't want them to feel shamed. If you've ever called somewhere and maybe someone wasn't that kind to you, like, no, we're not taking any more Medicaid. That really is something that I care about a lot. I don't want our patients, to feel bad when they're calling somewhere and trying to make an appointment. So that is something we've tried to take out as much of the guesswork for them and don't want to be giving them numbers that might just be a barrier for them. Next slide. And often, even when we do find appointments for some of our patients, just how far it is. So I live in Montana, but I grew up in the northeastern corner of Montana, up by the Canadian and North Dakotan borders. And that area is very desolate, and you can drive miles and miles and miles and see no one. And if you don't have a very reliable car and very reliable tires, some of these trips can be very, very dangerous. So we will have made appointments for people and not to any real fault of their own, just, it's how the weather that day. The car that they were driving in isn't reliable enough, or they were actually borrowing a car. I would go back and say a lot of times the phone numbers we've been given for kids, that might be a phone number of someone else who could get a hold of that parent. I just thought I would tell you that too, because I forgot to add that in. You can go to the next slide. So what I found is working in schools and working in nursing facilities and Head Starts is the people that it's usually who you least expect or might expect to, be a real help to you is usually the person who would be your biggest help. So we're always looking for volunteers. We're looking for people to help us communicate with parents and people in the community. I mean, it could be anyone from the janitor working in the building, a grandma who brought her kids in, someone working in the lunch area of the school. We work with a lot of teachers and administration too, but I think that always keeping your mind open into who you could be communicating with. These people live in the community. And also, I think something that we just might think of is, just being friendly to everyone when you go into a school, smiling at everyone, really understanding that you're trying to make connections with people. We're not just in there to get a job done. We do want to get the job done, but relationship building is just so, so important. You can go to the next slide. So we work a lot with teachers and counselors and school administrators, and there's just so many other people in the system who can be advocates for our students. But they can also help advocate for the things that we're doing. You can be talking about what you're doing and what you'd like to do in a community, how you feel that that could benefit the community. I feel like no conversation is too small. That has really helped us a lot. I feel like it was luck, but I feel like it was also just meant to be. When we're in an area, I'll talk to pretty much anyone, telling them about what we do. And so many people might not even know that we're there. I do want to add something is we've had these portable clinics that I'm super proud of. And there's really nothing in our mobile vehicles more that's in there that we don't bring in portably. But it's kind of interesting to see when we bring our mobile vehicle, so many more people know that we're there and they think that we're the real deal. That's been kind of hard for me because it's been great having a mobile vehicle, but portable is so much more affordable. We can, save so much money to the nonprofit and get just as much work done. But people don't see if they don't see the advertisement, if and for some reason, it's just going to take a while for them to dream up that you could actually, in fact, bring an entire dental office into a school or into a Head Start. So I think just talking a lot to people in the community is really, really helpful. And, never knowing where, some of these big collaborations are going to come from. The teacher, teaching first grade, things like this have happened to me where I come back and I find out that her husband is in fact the tribal chairman of, the tribe that we're working with. And I think it's just really important to be friendly and, be talking, but also listening. I think sometimes if we're talking all the time, but just really immersing ourselves into the community. I think it takes a lot of work at first, but the longer you're there, the easier it gets. You can change the slide. And I think it's important to talk about learning the community. What is this community like? Is there a small town dentist in the area? Where do they go to get their health care? Are they, is there a federally qualified health center there? Is there tribal health there? Are they driving 300 miles away? Where are people getting their health care? What do people in that community know about their health care? Really meeting people where they're at. I think sometimes when we're stuck in our, you know, a silo of, it's hard for some of us to even think that there's people who don't have really any dental literacy at all. I've seen that a lot in working in nursing facilities. We'll have, some of the CNAs, like I don't expect them to know exactly what I'm talking about. I just kind of meet them down in a kind of like, I'm going to show you and tell you how to do this. And, you can repeat it back to me, just meeting people in a way that they don't feel like they're being looked down upon for what they don't know, but instead given the opportunity to learn. You can go to the next slide. I think that when you're going into some of these rural areas, community involvement is a really, really big piece of what we do, knowing the community, volunteering when you're there. So we wouldn't at nights be working. I'd go to basketball games. It's like, but I love to watch high school basketball. I think it's really fun, especially small town. If you've never watched small town basketball, you don't even know what you're missing. It's some classy basketball. I don't think there's anything better. But you know, you know, if kids are doing fundraisers, we try to buy things locally when we're in areas. Just we try to find people that live in that area to actually work with us and be a part of our program. We try to stay as local as we possibly can. You can go to the next slide. I think some of the things that I started out working in nursing facilities and, my grandparents had finished off their, end of days in nursing facilities. And I would just go in and, wouldn't just go in like, I've got stuff to do. I want to see this many patients today and boom, boom, boom. I actually talk to the administration. And I think this might sound like, wow, like who has time to do all of this? But I think if you put in the legwork to begin with and you're talking to administration, if you're meeting some of the patients in the facility, if or if you're in a school, if you're talking to teachers, parents when they're dropping their kids off, if you're at the back to school night so you can be there to answer questions, these things are all going to make it a little bit easier for you further down the road. Building a rapport is just really, really important. And it doesn't necessarily have to be the same person all the time. I think, we've tried to streamline our nonprofit to the way where, you know, yes, we try to send the same people all the time, but when that's not possible, we're branded. People know who we are when we come in and they know what we do is good. You can go to the next slide. And how do they know what we do is good? So like when we go into a new area, we'll usually have like a smaller amount of people who actually sign up to our program. But I think word of mouth is that's how our program has grown. We've never actually been soliciting schools. There are areas that we want to be in because we know there's a serious need, but our program has grown by word of mouth. We've gotten a lot of acceptance. I think just to me and like the mission of our nonprofit is, we're there to be a part of the community. We're there to improve oral health disparities. And it just goes back to making the right decisions. We really do the very best job that we can for every patient that we do see. We try to communicate. And I think these things are all really, really important because especially when you're in a small town, people talk and word of mouth is really, really important. So I grew up on the Fort Peck Indian Reservation in northeastern Montana. It's in, like I said, that way northeastern corner. And, you know, I've been able to help find providers to come to that area for a long time. And, there's always different barriers that come up. But anytime I can help, I'm talking to people and trying to help communicate needs that are needed where I grew up. And I just learned so much from these, the opportunity to work with tribal health in that area. And, that goes back to communicate, communicate, communicate. Like I never burn bridges at, at anyone we work with. Maybe you'll take a break from working in an area, but I think really understanding um, that we're all in this to, we're here to change oral health disparities. We're here to improve things and really just knowing small towns. Like I know my small town, I can go up there at any point. You know, I think it's funny in small areas, you're always just 1 degree away from being related to someone. So I think really just improving your chatting skills and, like, hey, I know so and so, and we can bond on this, and people are a lot more open to talking to you about what you're doing. I did want to talk about screenings. Something when you're using like a screening event to, introduce yourself to a community, something that I've noticed, over the years that people don't necessarily just want to be screened. Like there's certain sub communities and communities that have just been screened over and over and over again. And they're almost hurt and resentful from it because, like, what are you just using that for data collection? Or are you going to do that to actually bring, like, to help us? And so that is really important because I've heard that over and over again. It's been really important to me that our program be able to, we don't just come in, even when we're doing our Head Start screenings, we make sure that we're giving them some other type of service. So if they already have a dentist and see them already, then they don't have to sign up with our program. We still might need to screen them, but of course we're going to remember to give them, toothbrush, toothpaste, those kind of things. We apply fluoride, I think giving them a service like applying silver diamine fluoride or, P11 for periodont repair, like those kind of things, those are really valuable. I think a lot of these small communities, they know that they have needs, and it's great that you're going to come in to do a screening, but you also need to bring a value to people of the community. So our program focuses on medical dental integration a lot. And we've also, when we go into an area, small, like school nurses, those are my people. I think it's really important that, we talk about communication, but we need to be communicating with the small town provider also. If the nurse practitioner in the town is the only person who sees patients, if they had an intraoral camera where they could actually share that information, that would be wonderful because there's so many people who just aren't being treated that it's just kind of crazy. And I think this is just a really good opportunity where we forget about the scope creep and just do the best that we can. And that also means communicating with other healthcare providers, looking at ourselves like we're part of the healthcare team because we are. And so I just want to say too, when it comes to communicating, when it comes to building something, so my program started out with, there were just 2 of us. There was 2 dental hygienists, and now we're a team of dentists, hygienists, assistants, and admin, bringing access to care throughout our entire state. We've, I think we saw, so far this year, we've seen 4,500 patients since January. We we're just all over the state, and there's about 25 employees right now. So from like 2 to 25, I just think that, anyone can do the things that we're doing. I think it just means that you have to, be really aligned with your mission and just really ready to, communicate with people and, live truthfully, I guess. And if any of you need to get a hold of me, this is my email address, and there's the website for our nonprofit and just other ways to get a hold of me. Thanks.
Crystal, thank you.
I made it.
That was wonderful. And we will make your contact information available to in our follow-up outreach to everyone who took part today. So we do have some questions already coming in. And I wonder, Rahel, if you would stop the share, we can take a break from that so everyone can see one another. So our faculty member, Caroline McLeod, uh, her first question, and thank you, Caroline, for this. Caroline says, I love the theme coming through that you can and should work collaboratively with others in the community to enhance impact of the work. When talking with volunteers, have you seen them be impacted in addition to individuals who receive the care?
Yeah, I think that so the experience we've had, especially in schools, they love the children so much. Like if someone's coming in and volunteering, they're not just there to take care of their own child. They're probably somehow have a relationship with this child anyway, because it is a small town. Rural areas, it is a lot different. And you definitely see people be impacted. I think sometimes, people who've had access and do go to the dentist, they might not know that their neighbors don't have that same luxury and they didn't even know things were going on. And yeah, people definitely care and they're definitely moved by it. And I think once they see, and this is a brag on our program, once they see how good of services that we bring straight into their school, they they want them for everyone they've ever met, like their entire community. I think sometimes them just even working with us, hanging out for a day, they kind of get like bit with something and they see that, wow, they could be part of improving someone's health. So
I love that metaphor. Caroline also asked, what kinds of questions have you seen open people up to talking with you when going into a new location?
I think um I think it's important to, ask them about themselves. I don't think you should ask somebody, oh, what's your job? What's your, what did you go to school? Like, questions a lot of people haven't went to college. I'm always really careful with asking those questions, but I like to ask about people's families, do you have a lot of family here? And I guess I try to listen more for opportunities to ask questions, what that person is interested in. I think in dentistry, especially, we're taught small talk and how to, communicate with people. So I feel like a lot of it is just really organic. So.
I was wondering too, I was struck by when you were talking earlier about how challenging it could be for folks to get to an appointment that's hundreds of miles away, and you never know what might be standing in the way of them following through on that. And I wondered, what can you do to explore that, just to see what if there are any social determinants or other barriers that people are going to have to getting their appointments or following through on treatment so that you can begin to problem solve if possible.
Um, there's tons of people working on that. So in my hometown, they obviously they would like providers there. That would be the easiest thing, right? So if you had all these providers there right on site. Montana Medicaid does do a waiver program where they actually will help to pay for some of the travel, but that's also a little tricky too. You have to call right after the appointment's been made. It's just, but barriers that our program has helped. So we know that they have to call. So we're going to say, hey, this is this number. After you make this, you're going to need to call these people. And a lot of the dental offices that we refer to help with that also. I know that where I grew up, they had like small, not bus, but like a small van bus car thing. I don't even know what those are called, but that they would take several people to an appointment. They'd make an agreement with an office and they were going to have all those patients seen that day, things like that. I think that our list, so um, just even going back to like how hard it is for people to call somewhere if someone's ever been mean to them. They might pick up on their accent or I think there's a lot of things that need to be discussed with barriers to care. One thing that our program is doing, and I'm super excited about it, we're scraping together all the funds that we can because we've had so many patients that we've worked on these referrals. We're trying to get these children seen, these adults seen, and it's just not happening there's a bazillion different reasons. depending on the day. And in Montana, quite often in the winter, it's weather. Like I've been getting kind of upset about that because our mobile vehicle, this first year we've had it, and I know I can't be pulling a trailer like on really bad roads. So starting in July of next year, we're gonna have a full-time dentist. And like it just makes me want to cry because I never thought we'd need that. I always wanted to have our program refer to the small town dentist, feed those offices. We've never wanted to step on their toes at all, especially if they take Medicaid. I want to send as much business their way, keep that going as much as possible. But what we found is that's great, but there's still a need to bring the restorative services to the people because there's still that small but large enough group that are never going to actually make it to the dental office.
Yeah. Yeah.
Sorry, that was really long-winded.
Not at all. That was great. Any final questions for Crystal before we move into our case? Yes, Anne. You'll need to take yourself off
Hi,
mute. You go.
yeah. Hi. I live in a very rural area, and it seems like we had fabulous dentists that all were in their 50s and 60s and then retired and sold their practices to big companies. And they bring in a new dentist right out of school, and they got big bills to pay off, and they're renting probably, and they have a so much that they have to make per year, a quota. And if they don't get it, then that dentist moves on and they hire somebody different. And we're just having a real hard time with people having consistent dentist every recall, etc. And other problems with Medicaid too. And I wondered if that's common in a lot of rural areas. And what do you say to patients or people when, I'm on a lot of different volunteer organizations and they tell me things like this, and I don't even know what to say to them.
So just to speak to that, I think dentistry is changing, the world is changing. You're seeing a lot more of like gig economy type things where a lot of dental hygienists are temping. It was for years people thought they could only see the same person all the time. I I think some of these big organizations making sure that people are trained to treat in the same way, there's good things and there's bad things. Um, I myself, even with our nonprofit, I would like to have the same hygienist in the same school all the time. And so many of those things aren't really possible. And it is the way healthcare has changed, the world has changed. There are good things about it too, is what I would say is, we do have providers that will come in. There are things that one provider might have missed. And I've seen this, I've been a hygienist for 25 years and another catches. So I guess just going to that positive side, because positivity is the only thing that's going to really create change, is that, yes, these things are unfortunate, but we're going to find the right people eventually, that this dentist is still a good person and they still want to do great things. It's just someone else. And it's really mainstreaming dentistry to be more the same, instead of having to go and, oh, I went to this office and they said I didn't have a cavity and this one said we did. It just maybe making it I just feel like there can be good in that also. I know that those comments are hard to hear, but I do believe that we have such a need for dentists and hygienists, and the whole dental field right now will never have enough providers for people to actually get all the treatments that they deserve. So we need to be working as efficiently as possible. And it is sad because I like small hometown things. We used to have a milkman when I was growing up, like all these awesome things about small towns that are just, it's dentistry is changing.
That was a good answer.
Oh,
Thank you.
thank you. All right. So, we're going to shift now into the case part of our call today. And our faculty member, Caroline McLeod, is going to be facilitating this part of the call. We're all going to stay together in this room, and I'll ask Rahel if she'll share the slides again so that we can have the case up on the screen.
Thank you, Stacy. I'll wait for the slides. All right, perfect. So for the case presentation today, we are putting ourselves in the minds of this particular case. So a rural community in Oklahoma has limited access to oral health care and is skeptical about outside interventions. A local healthcare organization hosts community workshops on oral health, aiming to build trust and engage residents in preventive care. We can go to the next slide. So thinking with that in mind, we have a few questions today. So I'll read through all three of them, and then we could probably just start with the first one. So the first one is, how can the healthcare organization effectively promote these community workshops to reach residents who may have limited access to technology and traditional communication methods? Crystal, I know you were even bringing up examples of that. So it fits right in. Number two is, what communication strategies can be employed during these workshops to connect with the community on a personal level and ensure that oral health information is relatable. And third, discuss the potential barriers the healthcare organization may face in gaining the trust of the community and propose strategies for building and maintaining trust. So no, the questions were a little bit long, so I'll take just a moment of silence just so everyone can ingest those really quick and do a quick read and think about what you might want to, or how you would answer.
And I've also posted them in the chat. So
Thank you, Stacey. So I'll give just a minute to think, and we'll start with number one.
and then Rahel, why don't you stop sharing so we can all see each other again, if you wouldn't mind, and then folks can refer to the questions in the chat. Thank you.
Yeah, that makes a lot of sense. Perfect. All right, so how can healthcare organizations effectively promote these community workshops to reach residents who may have limited access to technology and traditional communication methods?
We have very limited where we are, and we're sort of in a mountainous, hilly area. And some people have cable, and some people have Wi-Fi, and some people have just cell phones that don't work, even at their house. And so the more ways you can do it, even like Facebook and and any way you can announce it, I think is good.
I love that. And let's see, we have a comment in the chat. Ilum, thank you. Perhaps adverts in sign language or braille or billboards around town and on TV. Yeah, a lot of different ways, whether it's written or digital. I love that. That reminds me of a tactic that I've used before with the program that I'm a part of in North Carolina. And we actually took, we made these like written, like little post-it cards, and we took them around the local community in which we were having our event, and went to different apartment and communities that had like little administrative offices, and asked if they would pass them out. We'd put them on billboard or little post-it boards where the mailboxes were. So just like around the community, they could just pick one up that was printed and take it, go put it on their fridge or something like that. Had it in different languages as well. And we actually found that to be really helpful, because it was not a digital method, as people with challenges with technology, were really responsive to. Oh, and April said, local libraries can be amazing partner for getting word out and can also be a host for education events. I have never thought about that. April, if you are able to come off mute, I'd love to hear if you have a particular experience with that, especially in thinking with the children population and local libraries and parents bringing their kids there. I love that so much. And if not, that's okay.
Sorry.
Yeah.
I only have access to audio, but our local community, and I live in Michigan in a rural area, and many of our local communities host events for WIC, Head Start, as well as elderly who don't have access to a lot of other electronic means of communication. and also have transportation issues. And they have a lot of connections to local religious groups that can help remove transportation barriers and other. So they're deeply, deeply connected usually to the needs of the community and able to help with the navigation side.
Yes, that makes a lot of sense. Thank you so much. Not only getting the word out, but helping with any barriers that might keep people from accessing the particular event. Thank you. Annalisa, do you have something to add?
Oh, if April wasn't able to hop in with a example, I was going to share that we've experienced that here with our local libraries really serving as a community partner. They often can offer space for free too. So if you're looking for, a way to set up an educational seminar, for oral health education, or even providing direct services, those local libraries, because they're already community stops for all ages, can really be a great partner, both in kind of intermediate and ongoing care. I know our local library also likes to do a lot of themes for each month and really promoting that kind of piece. So maybe you can even create a long-term lasting relationship with your local library. You even partnering to give out a toothbrush when someone, checks out a book or something like that. It just really sparked in my mind how important our local library is. And I wanted to kind of double click on April's suggestion because it was a fantastic one that I hadn't really considered until now too.
Yeah, I totally agree. Thank you, April, so much. We have another comment in the chat, but we have two. Having campaigns at community events or community parks. That makes a lot of sense. Just honestly, places that community members go, I think is the theme that's really coming through here. And then food banks are a good place to pass along information. Thank you both for those. I'll add one more thing before we go to the second question. I think this really came across, Crystal, in your presentation, and feel free to add on. I see you're unmuted, so I'm not trying to take the comment away from you. But once you are in a community, you've kind of gotten initial connections in the community, maybe have done one screening or one event, how things start to spread by word of mouth, I think is an awesome communication tool that could absolutely be used, to follow up and continue to have events or provide services.
Yeah, I would just to piggyback on that a little bit too, is that, that you go in as your best self when you're going into a new community too. When you don't know people, you don't want to start on the wrong, I've told my people, you don't get to have a bad day at work. You've got to check your stuff over here because you're new in a community. Your people are watching you. They don't know what to think. They don't know, because there are groups that come in, and I grew up very much hearing people didn't like to be screened. They felt like people were just coming to get something from them, to get data from them, those kind of things. I think it's really important to just be on your best self when you're going into a new community. And other places that I would say that you might not have thought of, like senior centers. My goodness, it's a great place to get volunteers, but they usually know everybody. And those are a lot of people who are community based are at places like that. And other things that you don't have to have a religious affiliation at all. Like a lot of times it has nothing to do with us, but some of the different churches and things will be having events, and they will say, like, for some reason that's the people who invite us. So you just never know, you never know who could connect you in a community. So
Absolutely. Thank you for that advice. All right, we have a couple more comments in the chat, but I do want to make sure in the interest of time to move on to the second question. So thank you all for that input. So the next question is along the lines of communication strategies. What communication strategies can be employed during these workshops? So thinking about while it's going on to connect with the community on a personal level and ensure that oral health information is relatable. What comes to mind?
Caroline, one thing that comes to mind for me on that issue of being relatable is really engaging people from the community and kind of a train the trainer format to be representatives and leaders and inform those communication strategies and tactics. Something like a community health worker comes to mind, somebody who's a lay person and really understands the connections within the community, and then they're really there as a lay leader, and then hopefully as an expert as they work, with a oral healthcare team, to be able to inform those strategies. That's what came to mind about, for me, the personal level aspect, and then also those specific tactics could be informed. We may not know those, right? Crystal described something, working in a tribal and rural community where people struggle with telephone access, with internet access, even with physical and geographic access. And so maybe those are the things that come to mind as communication tactics. And she kind of outlined how those traditional strategies are not always the best path forward.
Thank you for that, Annalise. I totally agree with you. Crystal, when you said Facebook Messenger, I was like, never even thought about that. I was surprised by that one too. But absolutely, I mean, Crystal described working with, not using, volunteers in the community to really help with the communication during an event, like a school nurse or janitor or administration or CNAs. So I think that goes right along with what you're saying, Annalise.
I will say too, and when you're working with the elderly also too, like a lot of people just don't want the technology, and they might be relying on like their neighbor. They might not even have Facebook Messenger, but they're gonna go and get this person, and they'll probably come and show up at your event. I mean, it's just different. Small towns are a little bit more trusting of each other, and once I feel like I could say so many different things about that, but yeah, I wouldn't have thought of ever like reaching out to somebody on Messenger, but sometimes people just don't have, they might list a phone number that they had at one time, but because it's kind of embarrassing or makes them feel bad about themselves because they don't have that, so they're not going to not say they have it, but it doesn't work anymore. And so just even talking to people like, oh, hey, do you have this then? Like, what's the best way? And saying it in a really kind, open feeling kind of way. I don't know.
Yeah.
I can shut up.
No, you're very helpful. We are glad to have you here. I looked at one, thank y'all for the comments in the chat. I was just looking at one from McAllister. She said allowing for opportunity to collect questions or concerns ahead of time from the people who are coming to the event, the screening, the care, whatever it may be. And I'm curious if anyone has experience on how you could potentially do that, experience or thoughts on how you could do that.
I'm going to unmute myself because I'm the one who put that in the chat, and I can talk a little bit about what we've done previously with that. Is sometimes it's being able to like leverage, again, like we were talking about previously, other locations where we are not only just putting out information about the event, but like there's like a question box or like a opportunity, like having or maybe those tech involved people that like there is a QR code that they can scan and go to a Google form or something, but allowing, and I've found that sometimes in some communities, if they have the chance to like ask the question in a way that like they don't have to identify themselves as the question asker too, it can better promote like them wanting to seek the question for fear of like they maybe didn't want to appear ignorant or disengaged or what have you. So of creating a space where like they can ask the question without necessarily having someone like stare them down asking the question, but having space for them to like have a comment box or like a ask me anything kind of like little drop box that they'd be able to leverage, and then having that done prior to the event to help inform those at the event to like make sure we'll talk about these topics, or even just having them on hand to like if there's a time for Q&A or however you're structuring that, they already have something to work off of too.
Yeah, absolutely. That makes a ton of sense. I see a hand raised.
I'm in a master gardener group for a state, and you ask a question to the university and they find the right person. You ask it ahead and they have a meeting on Zoom or on a phone call, and you find out your answer, but they find the right person to give the answer that might fit either your garden question, but you could use it for like someone of the same type of person that asked the question, if you knew, if they were like a certain, from a certain family or a certain whatever in a rural area. And so sometimes you can match the answer, the person answering it, to the person asking the question.
Yeah, matching up expertise to the question. I think that makes a lot of sense as well. Thank you, Anne. And we have a couple other suggestions in the chat, and I really like this one from April. It says, keep messaging basic, use culturally appropriate materials. So much already exists, but much of it is too complicated or not representative of the community. And then potentially having dental companies or organizations in the community there to do free giveaways, oral hygiene kits.
So Caroline, I'm going to jump in and thank everybody for taking part. I know we didn't get through everything maybe we wanted to in the discussion and questions, but I'm going to invite folks to stick around as we do some wrap up and offer you some reminders. So Rahel, if you could share the slides again, please. And we want to start off by thanking today's presenter, Crystal Spring. Crystal, you were wonderful. We really appreciate your taking the time out of your day to join us and allow us to learn from you. CEUs are available for today's session. The survey link is going to show up on your screen immediately after this call. Recordings and resources will also be available on the AIDPH website in the coming days. As well, we'll be sharing a summary of the case discussion on the website so that you can see that and refer back to it if you'd like to share it with others as well. We invite you to apply if you'd like to present a case on a future call. There's a link to do that on our website as well. And as a reminder, our next call will take place on November 30th at 2:00 p.m. Central Time, where we will explore the topic of rural Indigenous veterans. Next slide, please. I also want to encourage everyone, if you haven't done so already, to please take advantage of early bird registration for the AIDPH annual colloquium, which is going to be taking place in March in Chicago, Illinois. The focus of this year's colloquium is community collaboration in dental research, advancing person-centered outcomes. We're inviting submissions for doing a speaking presentation at the conference. We have a number of discount codes available if you've taken part in our previous programs. And there is early bird pricing if you register, I think, by January 31st. Someone correct me if I'm wrong on that. And lastly, I'll make a plug. There is an optional pre-conference the day before this event begins. That would be on Sunday, March 24th, that will allow you to earn a leadership certificate by participating in the pre-conference, as well as some specific sessions at the colloquium itself. So please reach out to me if you have any questions about that, and we encourage you to take a look. And that's all we have for you today. Rahel, if you'll take us, I think, to the final slide. And I want to thank you all again for spending your day with us, part of your day, and wish you a happy Thursday. Thanks, everyone. Bye-bye.